Welcome to Startup Health TV. I'm your host, Logan Plaster. When Americans sign up for health insurance plans through their employers, millions of them choose what are called high-deductible health plans. These are attractive plans because the monthly premiums are lower, but there's a major trade-off. One major medical event and a sky-high deductible could wipe out your savings. Today I'm talking to Jason Pyle, CEO of a company called Vive Benefits, which has been with Startup Health since 2015. With Vive, Jason and his team are working to help people to manage their deductible payments in a way that will keep them out of medical bankruptcy. Vive helps people to borrow the money needed to pay their deductible in a way that helps them save money because they're paying cash up front, and also offering them a way to pay over time without the risks and fees of credit cards and without having to work with predatory lenders. Jason's unique approach to combining health products and financial products is gaining traction. I hope you enjoyed the interview. All right, we're here with Jason Pyle, CEO of Vive Benefits. Jason, thank you so much for taking a few minutes with us here for Startup Health.
Oh, it's my pleasure always to talk to you.
Jason, so we got to talk back in January 2020, which feels like about 5 years ago now. And you gave me the rundown of what Vive Benefits was up to at the Startup Health Festival. I think it's worth revisiting that and give us an explanation of kind of what you're working on now and kind of the flyover so we get Vive and then we can kind of dig into some details.
Well, of course, it's been a challenging year, 2020, as it has been for everybody. But we're really proud of how well we've done in 2020 at Vive. We've made a continued commitment to bringing products to people's health plans that keep them out of medical debt and structure their health plan in a way that can afford their out-of-pocket payments. We've launched a new product in 2020, rolled that out on the 1st of August. And we're looking forward to launching a second new product at the end of 2020, which is integrating Vive directly into an entire health plan, such that all the features of the employee health plan are covered in one spot. So it's been an exciting year for us, and we've had a lot of customer action and a lot of product development. So we see a bright future.
How did the turn of events in March and April specifically impact your business? I mean, how did your relationship with your clients change at the beginning of the coronavirus?
It's a great question. I think for everybody, it put a big pause on decisions that people were making going into 2021. And health benefits, which are normally being decided on by a lot of companies in the summertime for a 1/1, or January 1 launch, the season, so to speak, of people deciding that got quite a bit pushed back, and a lot of it is still happening right now. Because I think that a lot of strategic concerns of the companies got pushed forward as they dealt with the real tactical problems of 2020.
Let's talk about impact. You're using a unique financial platform, a product to help people with their high deductible health plans and helping keep them out of medical bankruptcy. Talk to me about how many people are sort of in this bucket that you're trying to help.
Well, 60% of personal bankruptcies in the United States are because of out-of-pocket medical expenses. And the number one reason why an employed American experiences financial distress is out-of-pocket medical expenses. So, we continue to ask individuals to share more and more of the cost and risk of health plans, but we haven't given them any better mechanisms to do that than buying a television at Best Buy.
Yeah. And in terms of folks who are currently utilizing high deductible health plans as a vehicle to afford healthcare, how many people are in that bucket? Do you have an idea?
Oh, yes. So high deductible health plans are one of the largest products in the world. So when you think about the scale of high deductible health plans at large, you're talking about a product size of about $800 billion. So approximately 30% of employed Americans are in some form of a high deductible health plan, and that can comprise as much as $200 billion worth of out-of-pocket expenses that those members will incur in a single year.
Okay. Walk us through the actual product. I know there's a card that you can use and kind of a way of really getting a loan for the costs that you need. I know you've just launched a new product. So kind of tell me where that program is currently.
Sure. The secret sauce of Vive, which distinguishes it from all the other payment provider and payment solutions, is we integrate our financial products directly into the health plan itself.
Okay.
So when an employer takes out a Vive plan, we build a suite of financial services into the plan, which allows the member to manage all of their tax-free savings, manage their HSA accounts and investments, get access to 0% interest credit, and make all of their out-of-pocket member payments on a single card.
Okay.
So at the beginning of a health plan, we issue all of our members a Vive MasterCard. It is not an HSA card. It is a out-of-pocket payment card. It's designed for that member to access the full deductible corridor worth of money. So if you're in a $5,000 high deductible, it has $5,000 worth of available funds on it, whether that's your HSA money or the lowest possible credit product that you could ever find.
It's almost one of those things that feels like it's too good to be true. Like, where's the fine print where, if I miss that payment, it like skyrockets? Is there a catch?
Well, that's a great question. Sometimes people hear what we do, which is to offer 0% interest and zero fees to employees, and they immediately start thinking about those late night TV ads, where what they're really trying to do is bait you into very, very expensive credit products with very, very high fees, which they eventually get to after you've gone through that period. Our guarantee to members is that when they're in our plan and as long as they're paying on their product, it will always be 0% interest and zero fees. We don't have hidden fees. We don't have hidden interest. So the question you're asking, which is, well, how do you do that? Because things aren't given away for free, is the health plan effectively becomes something like a credit union. It creates a very, very low cost, in this case, 0% interest credit product for the members of the health plan. And in that way, we can serve all the members of the health plan instead of just individuals who can individually qualify for credit.
Got it. So then your client is the health plan, and they're becoming the credit union. You're getting paid by them. Is there a sort of a value-based outcomes sharing model as well? And if you think about kind of how much we're saving these folks down the road, or is that not the model?
So our model is that we have total price transparency. We show our clients exactly what the services that we provide cost, exactly what the credit cost is to provide their employees the 0% zero fee lines of credit. And we're also putting a product in place when we do our plans, which is kind of like an unemployment insurance, which is what happens to an employee who leaves the plan and owes it money. So we have to be able to cover the credit costs and losses associated with that. And all of that is made totally transparent to they can really see that this is the cheapest possible way to provide their employees the ability to pay for their out-of-pocket payments. And one of the key features of especially our high deductible products, is that we're ensuring that every single dollar that employee spends for out-of-pocket payments is a pre-tax dollar. And when you do that, you dramatically lower the overall cost of capital that employee has to basically lay out for their out-of-pocket expenses.
Got it. What's been the response? What's your traction? Tell me a story about, someone who this has helped.
Oh, well, we've got tremendous market response. I mean, I think that there are a large number of employers who recognize that, benefits, especially now, especially in the environment that we've just gone through, one of the main issues for people is how do we manage out-of-pocket medical costs? So we've done very well in the marketplace. There's clearly product need. And we've been fantastic in servicing our members. I've got some great stories. I mean, mainly what we do, if you look at the majority of what we do, is we loan people $500 to smooth over a small incident. I mean, everybody could use $500 once in a while, right? Yeah. But we also have a lot of member stories that come our way that are really heartfelt and really important, and are really the reason we exist. So, who had a high-risk pregnancy. She was in a high-deductible plan, and she had some money saved in her HSA, but she had a pretty expensive pregnancy, which went right to the top of her deductible corridor. So normally, she would have been in a real pickle, right? She would have been reaching for some form of credit card, or worse, payday loans, or other forms of predatory credit. But in her case, all she had to do was swipe the Vive card. All the payment to the provider was made. She only had to worry about herself and her baby, at a pretty stressful time in her life. And in fact, the provider gave her a 20% discount for paying immediately at the time of service. So she went home later that day with a Vive plan, with a healthy baby, with a pretty scary incident, but everything taken care of, and then was able, over the course of the next year, as part of the plan, to pay down the cash advance that we'd made to her, ending with owing no money, a healthy baby, and a real peace of mind that nothing bad happened to her.
Is that term over which that debt gets repaid, is that different from case to case? How do you handle how long of a period that is?
So it's unique to how much money people need and how much contributions they're making to their HSAs. So one of the things we do in our plans is always create a structured HSA withholding. And that's the money that comes out pre-tax every paycheck from the individual and or their employer and goes into their HSA account. So we create that as a baseline for all the plans that we issue, and that serves two purposes. One, it serves the means by which our members accrue money in the absolute best tax-free savings vehicle that exists in the United States. And two, in the event that they need money in the form of credit that we give them, it also serves as the basis for future repayment. Because every new month they make a contribution to their HSA, we file a valid HSA reimbursement for them, and then they use that money from that future month's payment to pay down their credit line.
Got it. I was looking at your offering, and a question that came to my mind was, you figured out a creative way to sort of make health insurance healthcare more affordable within the current system. And yet there's a lot of people who would say that there's big sections of the current system that are broken and kind of need to be rethought. And so I wonder what your thoughts are about kind of optimizing the current system versus looking ahead and saying how we pay for things, the cost of care. It has some pretty fundamentally broken pieces to it.
It's a great topic, especially as we go into an election year, talking a lot about the future of healthcare in this country. One thing I would say is that the piece of healthcare in the United States that is probably most stable are healthcare benefits delivered from employers to the employees. Okay. That represents about 180 million Americans. So it is true that there are large segments of our population which are uninsured or individually employed or small group employed, and desperately need new solutions in order to be able to manage their healthcare. But probably the last category of healthcare, and the one that is probably closest to working okay, is the one that is employed Americans.
Got it.
Now, that said, I think that there are going to be a lot of changes in the future about how we deliver healthcare to employed Americans and how they consume it. But what I do not think is going to be going away anytime soon is the idea that at some level, individuals are financially responsible for some portion of their healthcare.
Yeah.
And really what we seek at Vive is sanity in that. right? Not the elimination of it, but can we create a way for the member who does have responsibilities associated with the payment of their health use? Can we make it sane for them? Can we make it reasonable? Can we take the risk of an explosive payment, coming their way out of their hands? And if we can do that, then we can make these kinds of private insurer options work in a way that they've never worked before.
Yeah. Yeah. What I also love and what I see in Vive Benefits is just this overarching idea of using the savvy and wisdom from the financial sector in the healthcare sector and say, look, we've figured out complex vehicles for payments in these other places. Now let's bring that knowledge over to healthcare for the benefit of the average individual. And that is a kind of knowledge base that I think will apply in so many situations, even as healthcare evolves.
We agree with you, of course. We think highly of our financial engineering of the solution. One of the things I said earlier was it makes no sense that for an employed American with a health plan, that the way that they are asked to pay for their out-of-pocket expenses is the same way they buy a television. Yeah. I mean, that makes no sense whatsoever. You're talking about a product that's embedded in a plan that has a whole assortment of tax-free savings mechanisms associated with it, insured or essentially collateralized by the payments they're making to the plan. Nobody should be paying 18, 19% interest on out-of-pocket payments when they're an employed American with a health plan. Just doesn't make any sense.
To kind of round this out with kind of a startup health moonshot question, when you look out and you think, okay, what's that big impact that I want to have? I know you want to reduce generally medical bankruptcies, but when you think about, okay, if Vive Benefits really catches hold in a massive scaled way, what kind of impact do you think you can have and do you want to have in the system?
Well, I can tell it in financial terms, which of course our investors and our customers and everybody thinks about a lot, which is that $290 billion worth of out-of-pocket debt that we incur every year as a society when we're forced to deal with these. So it's just an enormous financial opportunity to capture and an enormous financial kind of rework of where does that money go and how is it paid for in the system. But that's just the financial terms. When I think about somebody like Julia, who had a high-risk baby, I mean, the last thing in the world a person needs at a time like that is to be wondering, how am I going to come up with $2,000? And if we can create plans for people that fundamentally give them peace of mind, then we really have impacted the fabric of society and the country in a way that, I think that we really wish our healthcare system could.
Yeah. All right, last question. If I am a company that wants to work with you, or if I'm a person that has a high deductible plan and I'm like, I need a Vive card, what's the best way to learn more, contact you, et cetera?
Well, you can definitely check out our website at vivebenefits.com, all one word, Vive Benefits, and email us at thrive@vivebenefits.com. We get a lot of references through that, and obviously ask, most employers have large benefit advisors and stuff. We work with 5 of the largest benefit advisors in the country deploying our product. Ask your advisor, and we'd be happy to work with you and deliver you a product that we know your employees will love. And I think any employer looking at it is shocked at how affordable it is to really create peace of mind and financial stability for their employee base.
I meant to ask this earlier. How many lives are you currently covering through employer plans?
So we've covered around, in our product deployments, almost up to about 4,000 now.
Okay. In a particular region?
Mainly our work has been in the Midwest and down into Texas. Okay. So we've got a lot of exciting products that are being released right now, especially in kind of the Chicago area and the Midwest around in Texas and its surrounding states. We have a really exciting partnership that we announced with a plan provider called SimplePay. we are going in together as a complete plan, all the bells and whistles, including the insurance products itself, and distributing that now in the Texas area. So it's very exciting.
So you're not becoming the insurer; you're becoming the insurance plan provider. How does that work?
We are the payment component of it, and provide all the payment services and all the payment rails, both for the members and for the way that the plan acts with the providers in the network. And they're doing the insurance.
Okay. And is that your strategic direction going forward, that you'll handle kind of more and more of the payment structure?
We certainly can, and I think we have certain advantages in doing so, especially because we're already lifting the out-of-pocket expense component out of the plan. So as soon as, and by the way, most insurers will say that's the most complicated and problematic part to begin with. That's the one the provider networks are always complaining about. Like they don't want to be the ones collecting money from their patients. And so they're the ones who are always complaining to the insurance carriers, we don't want to be the one collecting money for your health plan. We don't want to be, hassling our patients for their copays, payments, but often that responsibility falls on them in order to get paid themselves. So when we come in with a Vive plan, one of the ancillary benefits is that the provider is getting fully paid at the time of services. And so this makes it a very, very attractive complement to an existing healthcare plan design.
That makes sense. All right, Jason. Well, I really appreciate you taking the time to get me up to speed on Vive Benefits. And more than that, I appreciate all the time that you've spent trying to crack this code on helping people out of medical bankruptcy, avoiding medical bankruptcy. It's such a huge issue for hundreds of millions of people. So thank you, and keep up the great work.